Hello again, everyone. My name is Marty Guthmiller. I am CEO at Orange City Area Health System, and I'm bringing to you today the 87th edition of our COVID-19 community briefings. And for the record, today is January 18, 2021. Have some normal things to bring you today, and then we'll go into probably the more interesting things, being the vaccine and some a graphic that shows how the vaccines are going to be administered. So we'll talk about that at the conclusion of this briefing today. First of all, I want to get to the numbers, and very good numbers across the board. Excellent numbers, the best that they've been in quite a while. Now, they're not perfect because zero would be perfect, but they are certainly heading in the correct direction. And so I'm gonna give you the local scoreboard, although that's not that important right now, I don't feel. But I'm gonna give you that number simply because some of you at home are probably keeping track, and you know, maybe it's important. So here goes. Our local scoreboard is 1,758 positives, 1,758 of 8,639. So that number remains at 20.3%. Again, not that significant, but for you historians, there you go. But for the week, which is a little bit more of an important number, for the week, we had 37 new positives this week in terms of individuals out of the 205 tested. So the positivity rate was 18%. Again, maybe skewed a little bit, a little biased, but one of the things is this thing is not over. And there are 37 people that were positive again this week through the testing that Orange City Area Health System has done. Moving on to Sioux County, good numbers. 14-day average was 14.3%. That is down from 18.0% and 15.5%, so 14.3. The 7-day average, which again is a little closer snapshot of where we're at, is even better, 8.5. We're in single digits, 8.5%. That is down from 12.5 and 13.3 before that. So very good numbers, particularly at the 7-day average. The positivity per 100,000 population, which is a number that allows us to compare to the state, over the last 7 days is 171.9. That is down 119.6% from the previous 7-day period. So again, a significant drop in the positivity per 100,000 population. A very good number, and the lowest that it's been in quite some time, actually, since we've been recording it. Again, from a standpoint of this isn't over, we have had 65 additional positives for the week in Sioux County. Now you say, well, okay, 65, how does that compare? For the week prior to that, we had 102 new positives. So then 65 number is down, but is certainly not as good as zero. Good numbers across the board though for Sioux County. Region 3, again, trending positively. 76 patients hospitalized with COVID as a primary diagnosis in Region 3, the 20 counties in Northwest Iowa. That number is down from 91 a week ago and 83 the week before that. We do have 12 patients in the ICU. That number is down from 20 the week before and 13 the week before that. We do have 4 patients on ventilators. Of those 12, that is down from 6 the last 2 times we reported. So declining hospitalizations, which of course is good. Iowa, 14-day positive average, 12.9%. That's down from 14.6 and 13.3. The 7-day average in Iowa is single digits, 9.2%, down from 11.8 and 12.0. The individual positivity rate per 100,000 population in the state of Iowa is 235.2. That's down 1% from the previous 7 days. That 235 is a number that you can compare to Sioux County's 171.9, which is definitely shows that Sioux County is below the positivity rate of the state as a whole, which is a good thing. In terms of the number of Iowans hospitalized somewhere, that number is going down as well, a constant theme today, and that's good. 483 Iowans hospitalized somewhere. That number was down 541 from previously, and 651 the time before that. Sioux County officially has 5 out of that 483 patients who are hospitalized somewhere, either in a Sioux County hospital or in a hospital somewhere. Just FYI, Polk County remains #1 in the state of Iowa with 79. So there's 79 hospitalizations of Polk County folks. Most likely, those folks will be in a Polk County hospital. And so again, it's not over by any stretch of the imagination. Another reminder that it's not over is we did have 186 deaths in this past week. The total number is 4,324. Sioux County officially 56 deaths now, and that is 8 more than we reported a week ago. So there's definitely still heartache. There's definitely still consequences to this virus in our state and in our region. No change at all in the demographic of the deaths. Still 94% plus are in the 60 plus category. And something we don't talk about a lot, but I think is a real blessing in all of this, is that there is 0% deaths in the 29 and under category. So that is a real blessing that the virus has remained. It's not that it doesn't infect people below 29, but we've had no deaths in that category in the duration of this disease to date. So I'm going to shift gears a little bit now, and I'm going to talk about what's going on locally. First of all, in our nursing home, every resident who wanted the vaccine received the vaccine 2 weeks ago. On January, or 3 weeks ago, on January 26th, Walgreens will be back to administer the Pfizer vaccine second dose to everybody that received the first dose. So that'll happen on January 26th. It will also be an opportunity for those that did not receive the vaccine, staff primarily that did not receive the vaccine the first time, to receive their first dose then as well. It also is a time for residents who may have moved in over the last 3 weeks to receive their first dose as well. Follow-up dose to those folks will be on February 16. So we're well on our way to having a fully vaccinated nursing home and assisted living facility, and that's definitely a good thing. Again, it's not over. We have had 3 additional positive nursing home residents this week, even though we're getting close to having some efficacy of the first dose out there. The virus is still alive and it has still infected 3 residents this week, which technically in the state of Iowa still puts Prairie Ridge in an outbreak status, which again requires us to keep things locked down a little more than we would like to, but that's the way it is at this point. The state of Iowa has come out with some new information, and what I'm going to try to do at this point is share a screen with you and then walk through this screen. So hopefully you can see this on the screen now, and this just came out today from Iowa Department of Public Health, and the title of this graphic is "When will I get a COVID-19 vaccination?" we've never had that question before, of course, right? This is the proverbial $64 million question. And what it does is explain the things that we've been communicating a little bit, talking about, but certainly adhering to, as applicable to the state of Iowa. These are different from other states. So if you're viewing this screening from other state, you got to look at your own state. I know South Dakota's like in 1D or 1E kind of categories right now, but they've completely restructured their phases in South Dakota. So these are Iowa phases, and this is what we need to comply with. Phase 1A, as most of you are familiar with, healthcare personnel, nursing home, congregate housing folks are in 1A. But phase 1B is something I want to talk about a little bit more specifically. And you can see right at the top of the list of phase 1B, which will be effective February 1st. And we're going to talk through that, but we will be allowed to vaccinate populations within phase 1B beginning on February 1. You can see at the top of this list that 1B persons eligible are persons aged 75 and older. And we are going to be following that. We believe the most vulnerable population that we have, and you need look no further than the demographics of the deaths in the state to support this. So persons aged 75 and older are at the highest risk. And so we'll be dealing with that, and I'll be walking you through that in just a moment. Other populations that will be taken care of in 1B, are eligible in 1B, are listed there, and you can look through that. Some of the maybe more easily recognizable classes in 1B, PK through 12 school staff, childhood educators, child care workers, first responders, police officers, those kinds of things are all in 1B and will be taken care of to the extent our supply allows. And then so that's going to be a big push, and we're going to talk a lot more about that in just a minute here. And then phase 1C is after that. We'll see what happens. Again, phase 1C, they indicate this exact date of spring of 2021. We don't know when 1C will happen. Most likely 1C will include 65 and older, certainly, but we don't know when we're going to get to that yet. And so for right now, we need to deal with what we know, and that is phase 1B will become effective February 1st. So I'm going to stop the share and then talk a little bit about how we plan to deal with the phase 1B implementation. First of all, it will be coordinated through our clinic here in Orange City. Please do not call the clinic yet to get your name on a list, because there will not be a list kept. So do not call the clinic. Please do not call the clinic and ask to be on the vaccination list. We're going to talk through this in great detail, more probably next week, but instructions will follow next week when we know the quantities. Each Wednesday, we are made aware of the quantities of vaccine that we're going to have for the following week. So on January 27, we will know and have the ability to plan for the vaccination given the number of doses that we're going to have. So if, for example, we find out on Wednesday that we have 200 doses that are going to be made available, and I'm making up that number, we will then plan for the vaccination of those 200 doses as soon as we possibly can. And we can go through 200 doses in a single evening. And so on the 27th, we will know what we're going to have for February 1. We will then follow up with another community briefing, probably in this format, along with other media as well, radio announcements and that kind of thing, in terms of how we're going to go about signing people up. We are going to follow the 75 plus eligibility requirements. It's all going to be dependent upon how many we get. If we get 100, if we get 200, if we get 500, it's just going to all depend on how aggressive we need to be. Most likely, we are going to receive a volume that would allow us to do vaccinations on a single evening. So for example, we may run a clinic from 6 p.m. to 9 p.m. And give the full allocation of all the doses we have, and then we're done. And then we'll say, okay, we need to wait a week, and we'll do it again next week, depending on how many doses we get. So we will communicate next week how many doses we get, when the vaccine will be, when the clinic will be held. Again, very similar to how we conduct a flu clinic, and all again dependent on how many doses we get. It's also important to recognize that every time we advance to the next phase, the previous phases are still eligible. So we will continue to do 1A folks, and they'll still be eligible. And we'll continue to, you can always go up the phases, you just can't go down the phases. So we'll continue to vaccinate the 1A category as folks become available, or as vaccine becomes available. But our focus, initial focus on February 1 is going to be 75 years and older. The industry eligibility, when you get into manufacturers and larger companies, will all be coordinated through community health partners and occupational health department. We are going to focus right now on the 75 plus on a more individual basis, but all of those industrial types of situations are going to be coordinated as we're able and as volumes merit and dictate through CHP and our occupational health department. That's a lot of information. It's good news, very good news relative to two things. One, our rates being down, our infectious rates being down, and secondly, that we're able to open up to individuals 75 and older. We've been receiving requests. I wish we could comply with all those requests, but we're going to be able to start to do that beginning on February 1. We will get the vaccine into the right people's arms as soon as we absolutely can. We have the capacity to vaccinate a lot of people in a very short period of time, and we'll commit resources to do that, provided that we have the supply. You got to have the supply in this case. So that's where we're at. Please don't call the clinic right now, because again, we're not taking names, but look for an announcement. We'll give you a series of announcements next week. Things change quite frequently. And so we will be back again online with messages as they become, as information becomes known to us. Thanks for continuing on this journey with us. The marathon is not yet over. We need to stay vigilant. We need to continue to practice all those safe practices that we've again become too familiar with over this period of time. We need to continue the race. We need to continue to utilize grace in many circumstances. We continue to see things manifest themselves in no small part to the strain that COVID has placed on us. So please extend grace to others. Please accept grace from others as well. And please stay strong, stay vigilant, and we wish you good health as you continue in this marathon. Thank you, and look for more messages from us as information becomes available. Thanks again for joining us.